In early 2020, when doubt and fear of the unknown began to surface with the COVID-19 pandemic, American Muslim health professionals, AMP, knew they had to step up for all Americans, for the communities they serve, and for the tenets of faith that help build the organization. So they embarked on a journey of impact and resilience. They built trust by addressing vaccine equity and combating misinformation, co-founding the National Muslim Task Force for COVID-19. AMP amplified its efforts by hosting COVID-19 webinars, including 2 webinars with the world's top infectious disease expert, Dr. Anthony Fauci, and over 120 partner organizations. And their efforts were seen on national media outlets. COVID significantly impacted mental health, which is one of AMP's core areas of focus. For years, AMP has been leading many initiatives to help reduce stigma around mental illness, including expanding mental health first aid trainings to communities across the country. These evidence-based training help participants understand signs of mental illness. Similar to how CPR training helps a layperson assist an individual following a heart attack, AMHP provides the skills needed to provide initial help. Children and young adults are facing a mental health crisis due to impact of social isolation, anxiety, and social media. So much so that the U.S. Surgeon General issued a youth mental health advisory.
Just juggling a lot, too much, and it takes a toll on our mental health. And unfortunately, with how mental health is stigmatized in our communities as well, it becomes very hard to navigate.
To address this crisis, AMP is delivering youth and adult mental health first aid trainings nationwide to destigmatize mental illness and empower people to support their loved ones. AMP strengthens the voice of Muslim health professionals to advocate for health equity and culturally competent mental health services.
So when Islamic Beef wanted to respond on Capitol Hill, no doubt there was no better partner that we could say, first of all, who can we learn from and partner with to advocate and lobby with has been AMHP. And that's what they've been doing for these past 2 years, raising that voice, giving opportunities for professionals like you, medical professionals, heads of community clinics to engage their senators, their public officials on how do we expand and improve health equity.
Fighting for a fair and equitable health system for everyone in our country is part of our faith. Since its founding, AMP has been advocating for policies that improve the affordability and accessibility of healthcare for all Americans, especially the most vulnerable. And they did, while representing the Muslim voice during critical moments for health policy advocacy. And in collaboration with long-standing policy partners within the Muslim and interfaith community, meeting with legislators, creating policy statements and action alerts, celebrating historic advocacy wins, such as the passage of the Infrastructure Bill and Inflation Reduction Act at the White House, and securing a seat at the table to engage with members of Congress and fellow advocates around ending hunger and diet-related diseases during the first White House Conference on Nutrition, Hunger, and Health in over 50 years. AMP is expanding its outreach at the grassroots level and established its first chapter in Texas.
Here in Texas, we are working with AMP National on public policy and mental health initiatives.
AMP was established in 2004 to harness the collective power of Muslim health professionals to commit to social justice and civic engagement,
to leverage our skill set, our educational background, and our expertise to work on public health initiatives for society.
AMHP is continuing to do incredible work serving the mental health needs of the American Muslim community, advocating with the Muslim voice in Washington, D.C., and we're continuing to do incredible work in health equity. It's a lot of work and it takes a lot of money. Please support AMHP.
Through its efforts with vaccine outreach during the pandemic, expansion of mental health first aid trainings nationwide, advocating for policies impacting minority and underserved communities, and expanding resources for Muslim-free clinics that serve uninsured patients. AMP members are implementing its mission to improve the health and wellness of all Americans.